last thing that I just wanted to touch on briefly is, again, going back to the inferior vena cava. The inferior vena cava traverses the diaphragm at T8. Remember, the aorta is T12. And at L5, it forms the right and left iliac veins. Remember, for the aorta, the bifurcation happens at L4. So just don't confuse those two. The other thing is, sometimes this comes up, the inferior vena cava filters. You're going to have to know a lot more about this for step 2. For step 1, you don't have to know a lot. But again, where it comes in is when they start to talk about anatomy. Now, just briefly, the reason that we would give a patient an inferior vena cava filter, there's two main reasons. First reason is maybe they were on anticoagulation and they developed a DVT, for example. So the patient essentially failed anticoagulation, or the patient has a contraindication to anticoagulation. Maybe they have a history of GI bleeds or something like that, or brain hemorrhages. And so in those situations, we would probably think about putting an IVC filter, an inferior vena cava filter, which essentially is used to capture the clot. If a clot were to propagate from a deep vein, like a popliteal vein or something like that, we can catch that clot in the filter, prevent it from going to the lungs. That's the concept. Okay, and these are particularly used, again, in patients that have lower extremity DVTs. If a patient had an upper extremity DVT, you wouldn't use an IVC filter, right? You would use an SVC filter, right? Just remember your anatomy here. And then you do have to interpret some of these axial images, and so that's why I include these in a lot of the videos, just to kind of get you familiar with this. Now, the inferior vena cava is actually right here, okay? And then your descending aorta is going to be there. So this is going to be let me write this down. This is going to be the IVC, and then this is going to be the descending aorta, okay? And you can see the liver is here. Here is going to be the patient's right kidney. This is actually going to be the second part of the duodenum, and here's the fourth part of the duodenum. But the big structure I want you to remember, especially for this video, is going to be the IVC. Now, the IVC, it's going to always be on the right side of the descending aorta. So if you're having trouble looking at a CT of the abdomen, remember that the IVC is going to be on the patient's right side, and the descending aorta is going to be on the left side. And they're usually going to be up against are pretty close to the vertebra, except as you start to move towards the liver here, the IVC is actually going to kind of come out this way, because remember, the IVC is actually going to go through the region where the liver is located, okay? So that's just something to remember. But in general, if you're stuck between picking the descending aorta or the IVC, between these two structures, just remember, again, descending aorta is on the left, or the patient's left, and the IVC is on the patient's right.